teeth. Smooth, strong, white. They are closely adjacent to each other, forming, as it were, two arcs of the correct shape. Moreover, each tooth, for with the exception of the lower central incisors and upper last lateral, contacts to teeth opposite jaw. Lower front teeth usually overlap the top ones by about a third height. If the dental arches are located like this, it means that human normal bite. At the reception, a young woman dissatisfied, with a capricious expression pizza no, her character is here. Nothing to do with it. It's just that the patient Enki is wrong at Kus. Too long the lower front teeth interfere with proper closure. Neum of the dentition. That's why the woman is used to move the lower jaw forward and formed like this. Called false progeny, lower anterior teeth would protrude forward and tightly adjoin the upper ones. Why do anomalies, irregularities, occur? Bite. Often the cause of dental deformation rows. Diseases of early childhood. Example, rickets. In this disease, it is disrupted. Growth and calcification of the jaws, order of eruption, teeth. Malocclusion often occurs when long-term disruption of nasal breathing. When person, for example, adenomas or chronic nose, he is forced to breathe through his mouth, actually chewing. The cheek and cheek muscles are constantly tense. Wives, under their pressure, the first row narrows, extends from the sides, and the lower jaw moves downwards. It forms, as doctors say, open bite. Sometimes malocclusions are the result of, i.e. so-called language habits. This is how the teeth broke apart, as a result of a bad habit. Press on them with your tongue. Took a lot of effort, from doctors to and even the patient herself, in order to straighten them out maybe. However, rarely did anyone think about how he swallowed. After all, swallowing is as natural as, say, breathe. But it turns out that for some, this is completely not easy. Usually during swallowing, the tip of the tongue finds support on the palate near the upper incisors. And, in some of our patients, the tongue rests when swallowing, is inserted into the lower lip, laying its way between the teeth. This requires significant effort from the facial muscles, especially the chin. After all, per day we make approximately 2,000 swallowing movements. Not surprisingly, due to constant pressure of the tongue, the inclination of the upper and lower incisors changes, and hard bumps appear on the chin. Sometimes people continue to have the habit of sucking the tongue, pushing the teeth with the tongue. This you can't do it. Our teeth can withstand pain vertical load when we bite. The incisors compressed with the force of up to 20-30 kilograms. But from lateral load arising under tongue pressure on their inner surface, they lose their stability, steadiness, become loose, may become inflamed, and the gum adjacent to them particularly adversely affects the bite. Decay and loss of teeth. It not only spoils appearance, gives the face an old look. Trying chew with the remaining teeth, the person involuntarily shifts, bends the lower jaw forward or to the side. Over time this wrong position is permanent, is fixed. In children, tooth loss can lead to more serious problems. Consequences: if baby teeth fall out early, after the deadline, the constants begin to grow, as they say, at random. As a result, they are not deformed, only the dentition, but also the jaw bones. Parents should consult a doctor without waiting until the child has permanent teeth. The dentist may find that removal is necessary. New prostheses. Don't refuse, they're comfortable, baby. He will quickly get used to his new teeth. Unfortunately, some people think that there is nothing to look after children's milk teeth. It doesn't matter, they say, they will fall out. This is not true. Milk teeth, affected caries, damage to hard tooth tissue, are quickly destroyed if they are not treated in a timely manner. In fact, the rudiments of permanent teeth may be damaged. Modern dentistry has effective methods of treating dentofacial anomalies. To widen the jaws, tilt teeth towards the palate or, conversely, tilt them towards the lip. Wire arcs. All kinds of flames are used. Walls with springs, screws, other accessories. Niami. All these devices place teeth in the right position. Restore the disturbed balance between. Using separate muscle groups, you can strengthen and activate weakened ones yourself. In particular, to learn to swallow correctly and also improve diction. Useful systematically in the morning and evening. 4. Do the following exercises 2-3 hours before bed. Count out loud from 20 to 40, trying to clearly pronounce DC sounds. 2. Click your tongue for 1-2 minutes. 3. Slowly running the tip of your tongue along the hard palate, from front to back to the soft palate. Hold tongue in this position until the feeling appears fatigue. Repeat the exercise 2-3 times. 4. Fill your mouth with water. Clench your teeth. Press tip of the tongue to the necks of the upper incisors and swallow water. Starting with 5 sips, gradually increase to 20. Be sure to do this exercise in front of the mirror. If you swallow correctly, face remains calm, facial muscles motionless. NIM. For those who have false progeny, that is, lower the jaw protrudes forward, and the upper incisors are deflected. In addition to these exercises, it is recommended also this: taking a flat wooden stick in your right hand, place it under the upper incisors, slightly tilting it down. Bite the stick with your lower incisors, lightly pressing it with your hand. Simultaneously left press your chin with your hand, pushing the lower jaw back. Thanks for watching. Visit my channel and subscribe.